Be ready 5 seconds.
Healthcare services in India are very important for the people. India is a big country with many people and everyone needs medical care. Healthcare means doctors, hospitals, medicines, and everything that helps people stay healthy. In India, healthcare is provided by both the government and private hospitals. Some people go to government hospitals because they are cheaper, while others go to private hospitals because they offer better services. Government hospitals in India provide free treatment. Many poor people go to these hospitals because they cannot afford private healthcare. These hospitals have good doctors and nurses, but sometimes they are too crowded. There are not enough hospitals for all the people, so many patients have to wait for a long time to see a doctor. Some government hospitals do not have enough medicines or equipment, which makes treatment difficult. The government is trying to improve these hospitals so that more people can get good treatment. Private hospitals in India provide better services, but they are expensive. People who can afford private healthcare go to these hospitals because they get faster and better treatment. These hospitals have modern equipment, clean rooms, and more doctors. But not everyone in India can pay for private hospitals. So many people still depend on government healthcare. In villages, healthcare services are not very good. Many villages do not have hospitals or even small clinics. People in villages have to travel long distances to see a doctor. Sometimes they use traditional medicines because they cannot find modern healthcare nearby. The government has set up small health centers in villages, but there are not enough doctors. More healthcare centers and doctors are needed in villages to help people get better treatment. In cities, healthcare is much better. There are many big hospitals and people can find good doctors easily. There are also special hospitals for heart diseases, cancer, and other serious illnesses. Many people come from small towns and villages to cities for treatment. But city hospitals are also crowded because many people need medical help. India has made many improvements in healthcare. There are more hospitals now than before, and more people are getting treatment. Vaccination programs have helped prevent diseases like polio and measles. The government has also started health insurance programs to help poor people get free treatment. One such program is Ayushman Bharat, which provides free treatment to many families. Even with these improvements, there are still many problems. Many poor people cannot afford medicines or hospital treatment. Some areas do not have enough doctors. In some government hospitals, there is a shortage of beds and medical equipment. To improve healthcare, the government needs to build more hospitals, provide free medicines, and train more doctors and nurses. Education about health is also important. Many people do not know about basic health care and hygiene. They do not know how to prevent diseases. The government and schools should teach people how to stay healthy. Simple things like washing hands, eating good food, and keeping the surroundings clean can help prevent many illnesses. Health awareness programs should reach every village and town so that people can take better care of themselves. Another big problem in India is the cost of medicines. Some medicines are very expensive and poor people cannot buy them. Many people have to borrow money to pay for medical treatment. The government should make sure that medicines are available at lower prices so that everyone can afford them. Generic medicines, which are cheaper versions of branded medicines, should be available in all hospitals and medical stores. There is also a shortage of doctors and nurses in India. Many doctors prefer to work in big cities because they get better salaries. But villages and small towns also need doctors. The government should encourage doctors to work in rural areas by giving them good salaries and benefits. More medical colleges should be opened to train more doctors and nurses so that there are enough healthcare workers for everyone. India also needs better hospitals and medical equipment. Some hospitals do not have enough beds, machines, or medicines. This makes it difficult to treat patients properly. The government should invest more money in healthcare so that hospitals have the latest equipment and facilities. Private companies can also help by building hospitals and medical centers in different parts of the country. Technology can play an important role in improving healthcare services in India. Telemedicine, which allows doctors to talk to patients through video calls, can help people in remote areas get medical advice without traveling long distances. Mobile health clinics can also reach villages where there are no hospitals. The use of technology can make healthcare services faster and more efficient. One of the biggest health problems in India is malnutrition. Many children do not get enough food, which makes them weak and sick. The government has started programs in schools to provide food to children. More such programs should be introduced to ensure that every child gets proper nutrition. When children get good food, they grow up to be healthier adults. Another serious health problem in India is pollution. Air pollution and water pollution cause many diseases. People suffer from breathing problems because of dirty air. Drinking unclean water causes stomach diseases. The government should take strong steps to reduce pollution so that people can live in a cleaner environment. Planting more trees, reducing the use of plastic, and cleaning rivers can help improve health conditions. Mental health is also important, but many people do not talk about it. Stress, anxiety, and depression affect many people, but they do not seek help because of fear and lack of awareness. More hospitals should have mental health services so that people can get the support they need. Schools and workplaces should also spread awareness about mental health so that people can talk about their problems without feeling ashamed. Women's health is another area that needs attention. Many women do not get proper health care, especially in villages. They do not get regular checkups during pregnancy.